I was a mess. I had fatigue and body aches, and my stomach hurt so much that I would grip the desk to the point where my hands would turn white from just severe stomach pain. And I went through this and slowly I got better.
Today's guest is Dr. Stacey Francis. For over 25 years, Dr. Stacey Francis has been treating patients using chiropractic, kinesiology, nutritional and functional medicine in Metro Detroit area. Her blend of advanced training and expertise allows her to help patients achieve optimal wellness through balancing the structural, biomedical and psyche system of the body, from neck pain to stomach pain, autoimmune disorders or allergies. Tired and couldn't figure out why? Dr. Stacey is here to help you. Welcome, Stacey.
I am happy to be here, and I can't wait to get started.
So, what is one of the most courageous things that you have done?
Probably write my book. That was a pretty courageous thing. And it wasn't courageous because writing was hard. It was something that I've been talking about for 30 years. But when you write a book, it's in the back of your mind, at least in the back of my mind, it was like, how will it be received? Will they understand what I'm saying? Will it be interesting enough? Are they going to hate it? Are they going to hate me? And so those horrible thoughts go round and round. And it took me about 3 years to write it, but I'm very happy with it. I think it's fantastic, but so do other people. So I've only gotten good reviews from it. So I'm really thrilled.
That's excellent. We will be talking about your book later on. What took you on your journey of becoming a nutritional and functional medicine? Did this naturally fall into place, or was it from your experiences?
So my parents both had diabetes and heart disease, and those are the most preventable diseases that we have, but they're most prevalent. It's almost like a rite of passage to get diabetes. And it became my mission to help people avoid diabetes and heart disease. And so that was my journey. I went to chiropractic school and learned all about that. Started with nutrition. I worked at a Salvation Army Rehabilitation Center where I was able to start my nutrition practice before I got out of school. And then I mentored with someone who was amazing with nutrition. And so it was functional medicine before it was functional medicine. We were always doing the labs we needed to do. We were always like, I do muscle testing. So I look at the body differently and evaluate it differently. So that was how I got to where I am.
Being from an Asian culture, those are the two things that are absolutely high on the list for most Asian families, and it's in the genes, it's inherited as well. So, yeah, absolutely excited to be learning more.
Right.
So, what could you see was the turning point?
I had my own health journey because when I was in chiropractic school, you would think that chiropractic students would be really healthy and have really healthy habits. They do not. And when you are studying for boards and when you are studying for your exams and running just like any other graduate student, it's a lot. And your health goes by the wayside and you pick up bad habits and bad food. And I was a mess. I had fatigue and body aches, and my stomach hurt so much that I would grip the desk to the point where my hands would turn white from just severe stomach pain. And I went through this, and I had a wonderful person, a wonderful colleague who was already in functional medicine who helped guide me and helped me discover things. And then I started taking courses when I graduated, and slowly I got better. And now I bring all that education that I've learned to my patients to help them.
Wow. So, yeah, so tell me more about your work. So, how do you help people?
Oh, I love my work. I am so blessed to be with people who actually come to me because they want to continue their health journey in a really healthy way. So their mindset are typically already there, or they're feeling so horrible that they're willing to do anything at this point. I usually see patients that have seen multiple doctors prior to me without success. And then we get down to the nitty gritty. We delve deep. We figure out where things are coming from, not just putting a Band-Aid on the symptoms, and we change lives. So my specialty is usually fatigue and belly aches, and they go together, and we investigate all of the reasons why you would have those symptoms. As a chiropractor, I see a lot of aches and pains, so I do that. But with functional medicine, it's usually those main topics. But people come to me for migraines, for hives, for skin rashes. We see all that, and we just have excellent results when we clean up our act. So if your audience, as we talk about all the things we're going to talk about today, if they do just that, their symptoms may improve up to 80%. And that last little bit might need a physician, right? Might need some guidance, but they can make huge changes just from what we're going to talk about today.
So tell me, what have they tried before and then they get introduced to you? So how can you help? For example, like you say, bellyache and tiredness and even migraines. What's going on for them?
When we look at, let's say, migraines, for instance, when you have migraines and you go to a traditional physician, oftentimes they will do blood work. And the blood work, when we talk about blood work, the ranges are very wide on traditional blood work. And optimal is very narrow, somewhere in the middle, maybe to the right, maybe to the left. And symptoms happen between optimal and falling off the edges. And it's not until they fall off the edges where a physician will actually do something about it. Like if you're low in iron, you have to be falling off the edges for them to suggest you should take iron.
Absolutely.
But we look at the ranges a little differently, and we will start doing healthy habits. And it might be, if you're just a little out of range, maybe we'll just suggest you increase your meat intake. Or we might suggest you use a cast iron pan or something called a silver fish, where it's a silver little fish shaped device that you put in your stews and your soups, and it puts iron into your food, and that's another way. Or if it's really severe, then we'd suggest iron supplements or iron IVs, something like that. Iron specifically is one of the most underdiagnosed problems in the world. And one of the reasons is because we have stored iron called ferritin, and then we have the iron that's circulating in our bloodstreams. And the insurance really only covers the iron circulating. And so when you're asking for the stored iron, it may or may not be covered by insurance. So it typically does not get covered, or doesn't even get drawn. That marker doesn't get drawn for the patient. But that can be the very first indicator of an iron problem. In fact, we have students who have ADD and ADHD. And what is the first thing they do? Because when you get diagnosed with ADD or ADHD as a kid, you're usually young, right? How many of you know a kid that had blood work done prior to being offered a stimulant like Adderall or Ritalin? Rarely.
No.
Right? But we found, the studies show that these kids are predominantly deficient in ferritin. Even if they took their blood, they're not testing ferritin anyways. But it's the ferritin that's low. And when they give the appropriate amount of iron for that child, resolution of their ADD and ADHD symptoms happen better than the stimulants. So why are we not doing this? We need iron to make stomach acid, to break down our foods and to get more nutrients. So we're going to become more nutrient deficient if we're iron deficient. And why are kids tired, usually if they're iron deficient, it's because their mom was iron deficient. If you're pregnant and iron deficient, then you have a bigger chance of having children who are iron deficient. Right?
Here in the UK, I must say, they do test ferritin.
That's so good.
Yeah.
That's so good. But, the range is what is allowable for the women. So we like ferritin around 100 to 120 for women. And oftentimes that range starts really low. And so if you're at 30, they think that's fine.
Yeah.
It might not be fine.
Absolutely. Yeah.
Right?
Yeah.
I'm proud that the UK does a lot of things that America needs to catch up on. Food safety is one of them.
Yeah. So what is, like, we started off with migraines. Tell me more about that.
Oh, okay. So that's one reason. Like if you're iron deficient, you have lots of different.
It's migraines to do with the iron.
Right. But migraines can come from so many different places. Where if you go to your doctor, you're going to be looking at those labs, and we're going to look at those labs, and you may or may not find anything. If they don't find anything on your labs, they're going to offer you a medication. And then if that medication doesn't work, or it ends up not working, you're going to get switched to a different medication, and then a different medication, or an injection. Like there are so many different medical treatments for migraine, but who has actually gone through and done an elimination diet to find out if their migraines are coming from their food or even their beloved caffeine? Right?
Yeah.
So I just had a call today with a patient who said that she was dealing with a horrible migraine, and we had just put her on some supplements. So I'm like, okay, go off your supplements. Let's make sure it's not that. And I said, is there any way it could have been anything else? And she said, well, I did go back on caffeine and then tried to get off again because it was causing me palpitations. And I'm like, oh, okay, it could be that. It's most likely that, right? And so she's had that before. She's lived with migraines. She went off of caffeine for a reason, and she tried to go back on it and had to go off of it again. And when you go off of caffeine, I promise you are going to have 2 miserable weeks. Promise. Horrible. It's easier.
I love my coffee.
I know, but it's easier just be off of it if you have those kind of reactions.
Yeah, I have cut back. I don't have as much, I can assure you.
Right.
Yeah.
Right. So there's other things. So food sensitivities are another thing that triggers migraines. And it could be dairy, it could be gluten, it could be alcohol, but it could be something simple that you didn't even think that it was, like oats or beans, or it could be something that you don't even think of. So sometimes we do an elimination diet to figure out what is triggering your whatever symptom it is. May it be migraines or something else. And migraines can also be from excitotoxins, which are components that actually do brain damage. And that's things like Equal. I don't know if it's that in the UK. I don't remember the chemical name for it, but that is something that is an excitotoxin. So is MSG. A lot of cultures use MSG as a flavor enhancer. I was a child, and my mom had Accent seasoning, which is straight MSG, and I was addicted to it because it opens up your taste buds and flavor floods in. It is delicious. That's why they put it in foods. But it's also an excitotoxin and a neurotoxin. And that definitely can cause migraines. Diet pop is another thing that is known to cause migraines. So things like this, and your doctor doesn't say, why don't you look at your diet? Or let's look at your diet together. What did you eat today? What have you been eating consistently?
Absolutely. Your food is the most important thing. What you're putting in is definitely having a result on how you're feeling, how you're reacting. Absolutely. Right. Yes. So tell me more about your book, The Supercharge Method, Your Transformation from Fatigue to Energize. Oh, wow. Beautiful.
Yes. So this is my pride and joy. The supercharged method is based on a lot of things, but it's basically how to get your energy back.
Mm,
And through the book, we look at, could it be anemias, which is iron deficiency or B vitamin deficiencies, or just not transporting your oxygen well? Is it from thyroid imbalance? Is it from blood sugar imbalance? And we talk all about that. We talk about what labs to do and how to read those labs. But in it, the gold, and if you do this one thing, most people make a huge difference in their symptoms, is the eating program. And I'm going to
mm.
share that with you. So this is the gold I'm giving you. If you do this today and you do it consistently over time, I promise you, you will notice a difference.
Tell
Because
us.
people don't know how to balance their blood sugar. And so what we
Mm,
typically see is you will skip a meal
mhm,
consistently. And
mhm,
then when you skip a meal, your frontal brain that you planned on having chicken and broccoli for lunch, now your primal brain that says I need fuel now says that chicken and broccoli for lunch, that's not enough. Because if you skip meals, your primal brain will say I need fuel now. So it's going to
mm,
reach for a carbohydrate, and it's going to be rice or bread or pastries or donuts or cookies, right? And it's going to want something that gets that sugar in really quickly. So your
mhm,
brain works again. And so it's going to do that. And so your primal brain hijacks your frontal brain, and you will make bad choices in regard to food. And so skipping meals does that. But skipping meals also, when you do it consistently and when you're reaching for sugar consistently, you're going to get this flood of insulin and this flood to try to get glucose into the cell. But you do that often enough, the receptors on the cell will get quieter and quieter. And because you're not giving your body enough nutrients to repair those insulin receptor sites, and now you become what we call insulin resistant, which
mm,
means now we can't get glucose into the cell. And the whole purpose of getting glucose or blood sugar into the cell is to have energy and
mm,
feel full. And now we don't have energy. We're falling asleep at our desk at 3 p.m. and we're constantly hungry. And so
mm,
we're constantly grazing or full, right? And looking for food. When if you do this technique, which I'm going to tell you in a minute, that will help balance your blood sugar. That will help get the insulin receptor sites healthy enough so the message gets into the cell and you feel full and you have energy. Okay, you ready?
yes.
It's so simple. It's one serving of protein,
Mhm,
two servings of above the ground vegetables, which are the vegetables that don't spike your blood sugar,
mhm,
every 3 to 4 hours in a 12-hour time frame.
mhm,
Super easy, right? So what we're doing, the protein is important for your immune system. It's
mhm,
important for your muscle growth and your metabolism. So protein's very important. What is protein? It's all your animal products. It's your beans. It's your peas. It's your lentils. It's your soy, your tofu, your edamame, right? That's your protein. Eggs, all that. Your above the ground vegetables are the ones that don't spike your blood sugar. We call them low glycemic vegetables. So
mhm,
that's things you would
mhm,
put in a salad. So potatoes are a vegetable, but those are below the ground. We're talking about
mhm,
everything above the ground,
mhm,
with exception to corn. Corn grows above the ground, but that's like more of a grain, right? And
mhm,
so what that does is it gives us all the phytonutrients to repair the insulin receptor sites. It gives
mhm,
us all our vitamins and minerals we need to be healthy. Without them, we can't function.
mm,
And it gives us fiber so that our detoxification system works and we're moving waste products through our body and having a bowel movement every day. If you are not pooping every day, we need to talk because that is so very important, right? We need to
absolutely.
get rid of those
Mm,
toxins every 3 to 4 hours. If you, because you want to eat enough of a meal to last you 3 hours. And that in between time is when your glucose and insulin levels can go down again. Because if you keep spiking your insulin, that's going to cause inflammation in your body.
mhm,
And
mhm,
you're going to be achy and you're not going to feel good. You'll be setting yourself up for disease and illness. So we want to eat and it will spike to whatever it spikes. And then hopefully not too much. And then it's going to go down. We're going to maintain that. And then we're going to eat again, right?
Mhm.
And so every 3 to 4 hours, if you're starving at that 3 to 4 hour mark, you didn't have enough protein and vegetables at that first meal. And then in a 12-hour time period, because we want 12 hours to allow our whole digestive system to rest. And that allows our immune system to start eating away at cells that shouldn't be there, dangerous cells, right? And so we can clean up shop in those 12 hours. And it could be longer. Some people
Yeah.
intermittent fast, and it can be
Mhm.
longer than 12 hours. If you do at least 12 hours, that's going to help clean up shop, right? So we're not grazing long periods.
Mhm.
We're giving everything a rest. And then what do we do with fruit? You can add up to 2 fruit a day, but you add it to the meal at the end of the meal so it doesn't spike that insulin as much. And I'm going to give you a fabulous tip. If you have a sweet tooth after meals, have a date. A date is so high in fiber, so high in potassium that it doesn't do a big blood sugar spike, but it's super sweet and delicious.
That's really brilliant. Yes.
Oh, thank you.
Yeah. So, what have people tried before you introduce them to your book and your programs?
Oh, well, this is what they do, especially my working women.
Mm-hmm.
So they'll go to work, they'll get really busy, they'll have brought their chicken and broccoli for lunch, they'll skip their meals, they'll see the donut on the on the conference table, they'll eat that, which will give them a huge spike. And so they'll be productive for about 15 minutes before they crash, that blood sugar crashes, and then they're super tired and they're falling asleep at their desk at 3 p.m. Then they're giving themselves caffeine, drinking all the coffee. And then they're so hyped up at the end of the day from the caffeine that they have to have wine to calm themselves down and get themselves to sleep.
Gosh, a bit of a vicious circle. For one, I'm gluten free. I'm a teetotal.
Excellent. You're ahead of the game.
Thank you.
Yes.
So tell me, why did you write this book and who's it for?
So I really wrote this book because it's what I repeat every day in the 30 years I've been practicing. So I've been talking about this with people for so long, and it just made sense to write it down and hand them a book and say, here's how I want you to eat, but here's the details. Here's the why and the how, right?
Yes.
And so it's for everybody. It's for everyone who wants to balance their blood sugar, feel healthy, have balance in their lives in a way that doesn't cause deprivation and doesn't cause craziness. It's not anything extreme. It includes all the wonderful foods and it's doable. So sustainable.
So that's brilliant. And what are their symptoms that they're coming for?
So most of my patients come from a whole variety of symptoms. But when I'm giving this program, it's because they are tired, they want to lose weight, they have skin rashes, they have belly aches. This will help with a lot of those symptoms. If they have thinning hair, if they are cold all the time, we talk about balance. We focus on some of the foods that will help balance your thyroid and help balance your iron levels as well. So we make sure that we're really covering the bases with the way we're eating in the book. And it has recipes and it has a food plan and we can, a lot of explanation. So it's very comprehensive.
Oh, that's excellent. So how does one get started?
Oh, well, there's so many ways. So on Amazon, you can find the book and you can just start. And if you do the 1 serving of protein, 2 servings of veggies every 3 to 4 hours in a 12-hour time period, if you do that, I want to know the results. I want you to contact me and tell me how you did with that and what you liked and what you didn't like. And let's talk. Also, you can find me on all over social media. I'm also available through my website. You can find me at specificwellness.com. And I take appointments as well. I take virtual appointments and inpatient appointments. I'm in Detroit, a suburb of Detroit, Michigan called Bloomfield Hills.
Excellent. What is important about them to know about labs, as in lab work as well?
Well, when you're looking at lab work, number one
Mm,
is just acknowledge that the ranges are very wide, and
mm,
your labs might be telling you something even if your traditional doctor isn't finding anything wrong. They might say everything looks great. So it's very common for my patients to go to their doctor saying, I'm exhausted. I am
mm,
utterly exhausted. And they go back time and time again, and their doctor says, your labs look great, your labs look great, your labs look great. They're waiting until you fall off the edges, until you're so severe that they find something. Where if you go to a functional medicine doctor, we're going to look at those labs a little differently. We might even do extra labs that are not traditional labs to find out what's going on. And we're going to treat you based on the subtleties. We're going to say, let's
mm,
do this. But when we work together, it's not like we're giving you a drug that's going to have side effects. We're going to do things naturally that's not harmful. So we have some room to play with the lifestyle and the diet. And don't forget your stress level. We're going to talk about what kind of stress is in your life that's draining you, that's making you increase your cortisol levels so much that you're in panic mode all the time. That
mm.
takes a lot of nutrients right there.
Absolutely. I couldn't agree more.
Yeah.
Absolutely. Thank you for sharing that.
You're welcome.
So, what is one of the most important lessons you've learned over your life so far?
Oh, so many, right? But it's really to listen.
Mm,
I have been in practice for over 30 years, and I am a different doctor now than I was then. So I've transformed many times over those
mm,
years because when you're first starting out as a physician, you have all this knowledge that you want to impart and you want them to do it just so. And you really like, you need to do this,
mm,
right? As opposed to now, I'm like, tell me where you're at. What are you willing to do? And then we talk about what results they could possibly get. Like there's a range. Do you want to do all the things? Can you possibly do all the things you need to do and have really quick results? Or do we
mm.
need to start slow and start transforming the lifestyle and getting better habits? And then the results might be slower, but at least you'll be able to have that longevity in the program to see the difference down the line, especially if you've tried all the programs, you've done all the things, but you can't stick to it. Then you're kind of over here.
So, what resources do you recommend, tools, daily steps for anyone that wants to start achieving optimal wellness?
There are many functional medicine doctors to follow on social media. I'm one of them. I do a lot of education and really pay close attention to your diet and your environment. So start with one ingredient foods. So that's nothing in a box or a bag, nothing processed, nothing made in a factory.
Mm-hmm.
One ingredient foods are chicken, rice, lentils, nectarines, tomatoes, rice, potatoes, right? Those are one ingredient foods.
Mm-hmm.
Crackers, not one ingredient foods, right? And so
Absolutely.
start with that. That's going to clean up your act initially.
Mm,
And then be aware of the toxins that are in your environment and the toxins that are in your foods. Glyphosate is something very prevalent in breakfast cereal, and especially in the United States. In the UK, you might be lucky and not have that, but in the United States, we have a lot of it.
mm,
And it does cause a lot of problems.
mm.
So does atrazine, which we spray corn crops. It can turn male frogs into egg laying female frogs. It is an
Wow.
endocrine disruptor.
Mm,
And when endocrine disruptors happen, and that can be from a lot of different products, even plastics being the predominant one,
mm.
it affects your hormonal system and it causes changes.
Definitely. Definitely.
Lots to do,
Yeah.
but first, don't panic.
Absolutely. And I know you gave your website out, but I'm going to ask you, where can the listeners find you online, your book? What's your website, Stacey?
My website is specificwellness.com.
And all the links will be in the show notes. And you have kindly given some links to some freebies as well.
I
So
have.
anybody listening, do please get in touch and look at the links.
Yes, there's a quiz on my website, and there's a quiz link that Anita's going to share with you. Please do it. It helps figure out where your fatigue is coming from.
Absolutely. Thank you, Stacey.
Thank you, Anita, for having me. I really appreciate it.
Oh, my pleasure. Thank you for sharing your insightful wisdom and knowledge with us today. And by doing so, you have helped so many others and make a difference. I really want to acknowledge you for that, Dr. Stacey Francis.
Thank you so much. Really appreciate you.
So we are all about Create the Courage to be Fearless podcast here. What is your definition of courage?
My definition of courage is doing things even when it's uncomfortable.